again, that's really a very important thing. And I'm not sure, Scott, we can really step back from the hype because the whole field and all the patients have been waiting for this for so many years, and now we have it. The question is how we can embed what's happening now with the cost, with a proper model to go forward. And I hope that some of the discussion will go there. And from that perspective, I'd like to hear from Gwen Darien on from a patient point of view, and Gwen is from a cancer support community.
Thank you. Scott, I'm really, do I have a slide? Whoops. I'm really glad that you had slides. I thought it was going to be really, really ironic. Oh, sorry. I thought it was going to be really ironic that the patient advocate was the only person with slides on this panel. But I only have two slides here, and I just wanted to put them up as one is a chart and one is a quote. But I think Lee Newcomber and I have probably been on 4 panels together on value. This must be our 4th panel. And one of the things that I would challenge everybody in the audience to really think about, and I know my colleague and friend and colleague Mark Gorman has talked about this as well when he's come up to the mic, is if we talk about patient-centered care and talk about putting the patient in the center, we have to ask the patient what they want, what she wants, what she values, what he considers to be the cost, which goes well beyond financial costs. There are multiple other costs to the patient. And it's really important to put that voice in the center. So when we talk about patient-centered care, what does that actually mean? And I think that it obviously doesn't mean the same thing for all of the different stakeholders, but I think the question of what value is has to be posited to the patient. So the other thing that Samir talked about was how much people were interested in immunotherapy and the emerging field of immuno-oncology. And so I have 2 things to talk about briefly from our cancer experience registry. So the cancer support community has a cancer experience registry, which currently has about 10,000 people with any diagnosis of cancer, as well as caregivers who answer a series of questions about their experience with cancer. And it goes from everything from the diagnosis and the treatment modality to financial issues, insurance, psychosocial issues, and an open-ended question about value. The other thing that we do with our cancer experience registry is that when we build a new program, we develop a survey. We have it IRB. We submit to the IRB, and then we field that survey into our cancer experience registry. So this first slide is we've had for about a year and a half now a very active, like many patient groups, very active education program around immunotherapy and immuno-oncology. We are actually in the 3rd reprint of our fact sheets, which is amazing because given the rapidity of the drug approvals. But what we did before we started this is that we fielded a survey, and at that point there were about 6,000 people in the registry. Within a week, we had 1,000 responses. So that shows you the incredible appetite for this information that patients have. But the other thing that we saw from this survey, which we also have seen from others, and one of them was clinical trials, is that there is a disconnect between the different answers. So I only have one chart up. I don't have 2 charts, but the first chart, when we asked people what they today, based on what they knew about immuno-oncology or immunotherapy, please indicate whether the following statements are myth or fact. So the 2 that were really important was that first of all, people thought immunotherapy had only been around a couple of years. And based on the kind of media hype, you would think that it only has been a few years. But then 56% said that immunotherapy is a natural treatment, so it has little or no side effects. This is a critical area of education, obviously. But then when you look at this next chart, it says that what people want to know about is how it functions, how the immune system functions, and then what the potential side effects are short and long term. So you see that there are all these gaps in education. So there are gaps in provider education, there are gaps in patient education, there are gaps in provider to patient education. So these are, we have a longer survey about this, which I'm happy to share with people because it's very, very interesting how people understand immunotherapy and how they look at value in terms of immunotherapy. Then the other thing that we have in our cancer experience registry is an open-ended question about value, and the question is, if you, in describing your cancer experience, how would you define value? And one of the things, it was a very open-ended question and deliberately open-ended. And one of the things that was so, oh yeah, we can put the quote up. No, this is fine. No, I don't have.
Oh, I thought you were
No.
Sorry.
I'm just looking at my notes. But one of the things that we found was that when people thought about value, the vast majority of them did not have an exchange-based notion of value. It was all about values driving value. What do I value in my life, and how does that impact my decision making? What do I value in terms of what I'm going to be able to do, and how does that impact decision making? None of it really was about what is the cost, but it was, and I would also just remind us, cost is much bigger than financial cost and financial impact. The But when they did talk about any kind of medical-based value, what they said was that what they valued the most was their communication with their healthcare team, which gives us a tremendous entry to create this kind of dialogue. Their communication with their healthcare team was paramount, and that was also paramount to how they felt about their experience with their treatment across all modalities. So, last fall we started a project. We had a summit for people with melanoma, with stage 3 high-risk melanoma, and some people with stage 4. And one of the things that has been talked about a lot over the last day and a half is what the changing experiences of people who are having immunotherapy or having diseases that are now are treated more chronically. And I think that this quote from a young woman living with melanoma, with stage 3 high-risk melanoma, really sums it up. It sums up the kind of bittersweet, as well as there's hope in the quote, there's sadness in the quote. I find that there are multiple very evocative emotions in this quote. And she must be in her early 30s. She's engaged, beautiful young woman. And this is what she said when we were talking about evolving hope and purpose. I think your purpose evolves as your experience changes. This is a chronic illness. It doesn't go away, and there is no end. My story comes up in daily life, and there are people close to me who don't want to hear my story anymore. Others want to move on. I'm not on treatment anymore, but they don't understand that physically and emotionally I'm not the same person I was before. And I think that is something that we have to consider in everything that we do. And I think so that is the most important statement to me of, I think, most of at least that I can make on this panel. So thank you.